The biggest pressure that I find practicing in Malawi is lack of resources. So sometimes even the basic resources are not available readily for us. For instance, just access to adequate IV fluid, sometimes it's not available to us, as well as just some other basic things like gauze for dressing the burns patients, and access to full blood count and other investigations that are required to manage the patients and sometimes not available. So it is quite difficult from that perspective. So the key benefits have been learning new techniques of doing some operations, as well as from the theory side of things. I have attended a couple of Pan-Scotland teachings, so I've also had some theoretical knowledge that has been imparted on me, which I'll obviously take back home. The most difficult thing is, I think, trying to prioritize which patients to give the resources that are available, because they're not available to everyone. So you can't offer everybody the same management, the same resources. And so sometimes it becomes quite a challenge to decide who to give minimal resources to and who to focus more of the resources on. So it is quite difficult because not everybody understands exactly where we're coming from. Although they know that there's not enough resources, sometimes there's questions about why they have to wait for so long to get treatment when they've come from long distances and they were hoping that we could help them, but we're unable to do that because of lack of resources or lack of theatre space, because we have a long waiting list. I would urge everyone of goodwill to chip in as much as they can into it, because the situation back home at the moment is quite dire, and any little financial support that we can get will go a long way really to help our patients in the hospitals. So I would really encourage anyone of goodwill to contribute to this fundraising.